Good morning, Professor. My name is Bhavna Sharma. I'm from NLM KBB. Here I'm going to present my capstone project's topic, that is workplace violence among nurses. Workplace violence is a condition when nurses get assaulted or threatened by the patients, their relatives, or any healthcare team member. This issue is very prevalent in healthcare organizations, especially in Canada. In a recent study, it is found that workplace violence is 4 times more common among nurses as compared to any other private sector. This study has been done by Occupational Health and Safety Administration in 2020. Another survey was conducted by Canadian Federation of Junior Nurses in 2017, where they revealed that 68% of the nurses get assaulted once in a year and about 29% of them get assaulted 9 times a year, which is quite shocking. When the nurses get assaulted, they cannot provide proper care to the patients and the quality of care gets affected. Patients also get dissatisfied and the nurses cannot make proper relationships with their relatives. Because of that, certain conflicts arise. Nurses also suffer from fatigue, depression, insomnia, and sometimes they try to quit their job because they cannot deal with the workplace violence. So, if there would be no violence, then there should be a positive change in the work environment, like they can work to their best, they can maintain their personal and professional balance, they can provide quality care to the patient. But there are certain barriers that do not let it happen, such as when there is no support from the management, though no adequate knowledge to the staff about their rights and policies. So here healthcare leaders play an important role to provide knowledge to the staff. They should stand with the staff members that if anything wrong happens with them, do not accept. They should raise voice for their own. So in the work plan, if I would be a leader in future, I would be a transformational leader for sure. I would motivate and inspire the staff regarding their rights and policies. I would identify the issue, provide education to them, and foster the communication where they can tell the problems without being shy, and they should be confident about their rights and policies. So in the theory, I would use transformational leadership theory. I would definitely collect feedbacks and identify the root causes so that I can try to eliminate the workplace violence from my healthcare staff setting. In the theory, I would use change theory given by Lewin so that I can bring the positive change. In this theory, I would let the staff know about their rights, and also the main thing, I would let them know about the zero tolerance policy, that not a single non-ethical behavior is acceptable, and there would be posters all around the hospital or the healthcare settings where the relatives can get to know that no single non-ethical behavior is acceptable, and they get reminded about that. So in the expected outcomes and sustainability plan, in expected outcomes there would be changes if there is no workplace violence, like nurses can work with respect and dignity, they can maintain their personal and professional balance, they would provide best care to the patients where they can get satisfied, and there would be less mortality rate, and there would be proper relationship with the relatives where they can discuss their patient's problem and so on. But there are still some barriers that create some issues in the expected outcomes, such as when the staff still do not get in-service education, healthcare leaders do not support them, and they do not get proper rights and regulations regarding their safety. In the sustainability plan, there are certain barriers, like when there is high tolerance power among the staff, they do not notify the violent cases to the management, and when the management do not support them, when they notify the management, they do not give any proper response, then it also decreases their confidence. But leaders should do certain things to make this idea sustainable, like they should make updation in the policies according to the feedback, and they should identify how many cases are coming these days as compared to the past. They should make comparison between the violent cases before and after implementation of the solution. So in the plan of sustainability there should be four steps that should be followed. In the assessment, everybody should do identification of the violent cases, and in the planning we should arrange workshops, in service educations and rights, and review the rights and policies. Another thing, in the implementation we should implement all the planned solutions. And evaluation, there should be frequent evaluation in the policies and rights so that required changes can be made to make this idea sustainable. Furthermore, need of education is very important. Only then new staff and the old staff can get to know about their policies. Only then they will follow that. And there are certain things that would ensure its sustainability, like if there is proper education, proper communication, where the staff members can communicate their problems with the leaders and their healthcare team members, and proper managerial support, then workplace violence can be eliminated. So this is all about my topic. Thanks.